really appreciate our local doctors being just a phone call and a text message away. UT Health Science Center, Houston, Brownsville Clinic, Dr. Joseph McCormick from Cameron County, our Health Authority, Dr. James Castillo, and hope to hear shortly from our Hidalgo County Health Authority, Dr. Ivan Melendez. Roxanne, I'll give it to you because I know you got the first question of the afternoon. Go ahead, Rox.
Yes, thank you guys so much for joining us. We appreciate it. I know so many of us have so many questions to ask you, so let me get right to it. Can you explain how this vaccine is different from others and why it's able to be 95% effective? Whoever wants to answer it.
This vaccine is different than others. It's using the two vaccines that are out right now are using a new technology, that mRNA technology, so that instead of using a weakened virus or another virus that's kind of crossed with the COVID virus, this goes straight to that spike protein instructions. And when you get the injection, that genetic material gets in those muscle cells. Those muscle cells start making just that spike protein of the coronavirus, and your immune system gets to learn how to fight the coronavirus without ever getting exposed to the coronavirus.
So, Roxanne, one of the differences, though, there are actually several vaccines out there. The two that we have now, the Moderna and the Pfizer, just as Dr. Castillo described, are made to do that. There are two vaccines that are on the horizon that use a slightly different technology. One is a company called Novavax, and they actually make a protein, a purified protein that is also the spike protein, but it doesn't go through the replication that the mRNA does. And the other one is actually a technology used by two companies, and it uses an adenovirus, which is a virus that causes a common cold, except they use an adenovirus that doesn't even replicate in humans. I won't go into the weeds, but it also expresses in a different way the spike protein, and ultimately the process biologically is almost the same. But we're going to have a number of these different vaccines available pretty soon.
Let me also ask a follow-up question real quickly, Dr. McCormick. We know that with the Pfizer and the Moderna vaccine, for sure the Pfizer, when you get your first dose, it's over 50% effective with just the first dose. And then with the second dose, that's when it jumps to 95%. Why is that? How does that happen? Explain why the first dose is just over 50, which is still great, and then the second dose is what gets you to the 95% effectiveness.
The first dose is what we call a prime dose. It primes the immune system. It's never seen this virus, and at least most people have never seen a virus. Now, there are some coronaviruses that cross-react a little bit with this, and this is an area that we don't know very much about. But most people have never seen this virus or this protein, this spike protein. So that primes the immune system. It gets cells ready, and it gives a fair amount of immunity, but it doesn't give as good immunity as you get with the second dose, which really ramps up your immune system so that it's. Now, the question is, how long will that ramp up last? And that's something we haven't learned yet.
If I could chime in real quick, Dr. Mack, because I know this is your bailiwick. Some people have expressed concern about this wonderful new the vaccines, plural, but some are RNA based. They're kind of different. You're not putting in a dead piece or an inactive piece of a virus into the body. It's more RNA based. You think the reservations expressed by some in interviews about long-term effects of this new type of vaccine, this new approach, do you think those are unfounded, or is there some validity to that?
I think they're pretty unfounded. I think there is a misconception out here also, Sergio, about how quickly this vaccine was developed. Yes, the vaccine itself, the COVID vaccine, was developed in less than a year and tested. But the technology, the science behind this is well over 20 years old. So this science has been extremely well developed, and interestingly, it was developed primarily toward trying to use it for cancer. for treatment of cancer and even prevention of cancer. And it still has a lot of promise in that area. But in fact,
Wow.
what happened was the companies that were working in this area said, oh, once they saw the COVID virus, they said, oh, we can make a vaccine really quickly with this technology that is, yes, new for vaccines, but has long been developed. By the way, the vaccines were developed by immigrants. In the US, by a Hungarian woman who immigrated to the US, and it was at the University of Pennsylvania. And in Germany, by a couple from Turkey, who are the co-founders of the BioNTech company that you see is associated with Pfizer.
This is a COVID vaccine update for the RGV. Our guest at the moment, UT Health Science Center, Houston Brownsville Clinic, Dr. Joseph McCormick, and our health authority from Cameron County is Dr. James Castillo. Let me lob it over to Davis Rankin. I know he had a question for Dr. Castillo. Go ahead, Davey.
Yeah, Dr. Castillo, there's an operation in Harlingen that does, as I understand it, monoclonal infusion. Can you explain what that is for those of us who didn't do very well in science? And what do you think about it? Is it helpful?
Sure. There's two products out there that are under emergency authorization to treat COVID in the early phase. So if a person has risk factors for getting severely ill, they have severe obesity, they have diabetes. We know these are the patients, if they get COVID, could end up in the hospital. When they're newly diagnosed, before it gets out of hand, before they start getting pneumonia, we can infuse them with this antibody that'll bind up that virus as if their immune system was already ready to fight it. It's trying to give their immune system a head start. Okay. And in the studies, it looks like this reduces the risk of those people getting sick enough to get put in the hospital significantly. So this is a tool we're using to prevent people who have already been infected. They've already tested positive. They have risk factors, and we're using this as a treatment to try to avoid them from getting sick enough to end up in the hospital.
And that would it be appropriate to give it to somebody who has tested positive, has the risk factors, but apparently is not suffering from it? You want to
Exactly. Even if a person's asymptomatic and they have the risk factors. So this is anybody 65 and over, people with diabetes, people with severe obesity. We've treated over 400 patients already. In a lot of parts of the country, they can't even give this because these people are very contagious. They can't be going to an infusion center, and here we're lucky enough with sponsorship from the state and funding from the state to have an infusion center so that local primary doctors, me with the health department, we can evaluate the patients, refer them for this infusion as fast as possible, because the sooner you use it, the better, and help to prevent people from getting sick enough to be in the hospital. It's not a guarantee. There's still people who end up in the hospital who get this treatment, but we're probably saving people from getting sick and put in the hospital.
Okay. Thank you.
I didn't even consider that these folks are using the infusion center. They're COVID positive. They're COVID positive, and they're showing up to receive that infusion. So you guys must have like the highest level of protection for all workers providing.
Yeah, that's the hot zone, right? For sure. It is definitely a hot zone. This is where we had our alternative care site when we had the first surge, and now this is probably a better use of it, is to try to keep people from getting into the hospital, because once this disease gets going, it can leave people with a whole lot of damage and in the hospital for a long time. So if having access to this treatment in our community, like I said, across the country, this monoclonal antibody is sitting on shelves, and here we are infusing it. It's just been absolutely great. We're really fortunate to have it.
So Davis, let me clarify one thing. Somebody may say, well, why don't you give this to people who are already in the hospital who are really sick? Yeah. And there was an arm of the trial that was ongoing that did just that, but in fact it didn't work very well at all, and in some instances it made people worse. Wow. So the NIH actually stopped that arm of the trial, but it seems to be much better, as Dr. Castillo has said. for people early on. And without going into the weeds, there are reasons for that. And what you're essentially doing is just pouring in a huge amount of antibody that your vaccine would normally make for you, but you haven't had the vaccine. So now that antibody is trying to prevent the virus from dividing or replicating, and it really does seem to help. So I think this has been a real good advance.
Good, thank you.
20 minutes after the hour, you're listening to a COVID vaccine update for the RGV. Our guest from UT Health Science, Dr. Joseph McCormick, and also from our Cameron County Health Authority, Dr. James Castillo. Your questions, welcome, Sergio at KURV.com. But the fastest way to get it to us would be via News Talk 710 KURV or a Facebook Live broadcast. Post your question there, and Zach Cantu will weed through those questions, send it over to us. Let me take a quick break, and we'll come back. I know Roxanne has a question about the vaccine rollout so far across the area. Thanks for joining us on News Talk 710 KURV and also Classic 92.7 FM for Cameron County. Bird Ogden dealers across the Rio Grande Valley specialize in luxury. Shop online at birdogden.com. And know this, if you don't want to touch anybody, you don't want to see anybody, from A to Z, the no-touch purchase of all these luxury brands. From Bird Ogden Fiesta dealerships, our CEO, Natasha Del Barrio.
It's an incredible convenience factor. The reviews that we get back from the customers who have taken that process completely from A to Z are just phenomenal. They're so excited about it. It's just like anything else. Amazon, we can have something on our doorstep. 2 days later, I bought a bike rack for my car yesterday, and I was too busy to go get it. And so $6 later, with favor, it was sitting at my doorstep. And I think that we have all become accustomed to these types of conveniences. And certainly a car purchase is more extensive than a bike rack, but it is wildly more convenient than it was 2 years ago to come in and purchase a vehicle. The feedback that I get back from the dealerships is that for the customers who start the process online, they select their vehicle, they submit their information, they select the lender they'd like to work with, any additional products they may want to add to their vehicle, and complete that purchase online. So certainly we have made all the necessary adjustments, implemented all the necessary tools to make sure that customers are well protected when they are submitting their information to us online, and it is subject to all the same privacy and protection that you would have in the dealership, and certainly that people are accustomed to when they're shopping. Once they come into the dealership, the vehicle is parked and ready, waiting for the customer. They come in and validate identity. There's maybe 3 or 4 forms that are required by state law to have a wet ink signature on them. They explain the vehicle to the customers and move on down the road. And this can eliminate as much as 4 hours to the car buying process.
Thank you to the Bird Ogden family for today's special KURV broadcast. Learn more at bertogden.com. Time is 4:23. A COVID vaccine update for the RGV as presented on News Talk 710 KURV, Classic 92.7 FM. And join us live on Facebook, the studio broadcast via Zoom at News Talk 710 KURV, Facebook Live. Dr. Joseph McCormick from a UT Health Science System and Dr. James Castillo, Cameron County Health Authority. Roxanne Flores, back to you, friend. What you got?
I wanted to ask both of you guys this question, but first, Dr. Castillo, if you want to answer it first, your opinion on the vaccine rollout and how it can improve.
Trying to know when you're going to have the vaccine, how much you're going to have, the storage supply for it, the logistics that go into just having it drawn up and then not wanting to waste any of it is just ridiculously challenging. I don't think anybody knew exactly how this product would have to be shipped and then distributed. And obviously people are really frustrated about this scheduling and when am I going to get my vaccine, and where's I wish there was a national system for it, or a national medical record, or even a state-based medical record. We don't have that. Right now, with the crisis we're in with the hospitals, I think the best use for the vaccine is to get it into people as fast as possible rather than sitting in a freezer or refrigerator. I think, we saw Texas take the lead in that. The federal government has come along with that same thought, is get it into the high-risk people. So all those same people who I talked about getting monoclonal antibodies if they get sick, let's get the vaccine to them before they get sick. And from the county's point of view, at least from our point of view, is it's these mass events. It's certainly not the ideal way to do it, but it's the quickest way to do it right now. And hopefully you'll see this vaccine become more available in pharmacies, your doctor's offices, clinics that are open all the time as the supply increases. But right now, with a limited supply, the best way that we have to get it to the people quickly is these type of mass events.
Dr. McCormick?
So I think that this is another illustration. We actually did know about what was going to be required for storage and shipment because the companies knew this and conveyed it, but it wasn't planned for. And so, for example, in our area, the only organizations that really had the storage particularly for the Pfizer vaccine, were the universities. We happen to have a whole series of freezers because we do a lot of research, and that's true for UTRGV as well. But these are not standard kinds of things that clinics, hospitals, pharmacies, or others have. So that really has limited, and this could have been planned for. And it wasn't. And so, secondly, the companies are way behind on production of vaccine. And if the Production Act had been invoked much earlier, then many of the reagents, the things that go into making this vaccine, could have been available to make much more vaccine available. So there have been many problems along the way that were foreseeable, and that could have been that better planning could have helped to make this work much better. I totally agree with the idea that we need to get these vaccines in arms. There's little point in holding back the vaccine for the second dose. We can't even get the first doses into arms, and so I think that is something that is now being pushed very hard and is important. But as the mayor of New York said this morning, his problem is not that people don't want the vaccine, is he's going to run out of vaccine by the end of the week. And I wouldn't be surprised that's probably true locally. I know that this morning, there was a vaccination program going on in Los Fresnos in Cameron County, and they ran out of vaccine within the first hour, because people stayed overnight to wait to get the vaccine. So this is a serious problem, and it definitely needs to be addressed. Now, we have two other vaccines coming along that I mentioned earlier, Johnson & Johnson and Novavax, that do not require these kinds of storage, that are much more, and Johnson & Johnson is a single-dose vaccine. So we may have some better options as things move forward.
Before we go to more questions, let me go back to Dr. Castillo. Dr. James Castillo is our Cameron County Health Authority. Status of your COVID floors, Brownsville and Harlingen hospitals. How are you right now, Doc?
They're all very, very full. ICU capacity's up, more people on ventilators. They're very, very full, and they're holding steady at that very full level. So far things are holding steady, but extremely full.
Can you put it into perspective? Can maybe compare it to where we were compared to the high water mark a few months back?
Probably 60 to 70% of the way there.
Wow, that's a lot. Is that Christmas and New Year's finally showing up?
I think it keeps rolling in. Yeah, it's definitely showing up, but I don't think we've seen the end of that.
So Sergio, a couple of comments about that as well. One of the things is that the hospitals have all lost staff to some of these agencies that are paying large amounts of money. And I meet with the two hospitals in Brownsville regularly, twice a week. And I know that this is a real problem with them, because they can find beds more easily than they can staff. And particularly with this disease, it requires really some very careful monitoring when people particularly are on ventilators. So that's really an important issue. And and they don't have the kind of staff that they had back when we had the big surge in July and August.
You have to pay them what? I don't know what a
Go ahead,
nurse,
David.
I don't know what a nurse is getting. I'm not sure how to, but what is a skilled nurse? What does it take to get them here? 75,000, 100,000 more?
Well, it's whatever it is. It depends on obviously who's paying, but whatever it is, our hospitals cannot afford it. And they made that very clear. They're getting some help from their corporate offices. So that is helping. But the fact is they simply cannot afford the very high rates that are being paid by these agencies. And so that really does make it complicated. And that's happening all over the country. It's not just here.
Yeah, that commentary has come to us over many months. Local nurses employed by our local hospitals having, their salary, not compared to the agency rates that are, might not be an exaggeration, 3 times more than what the salary is being paid at the local level.
Wow.
Those agency people are being hired and brought down here to try to meet the need. Dr. James, before we go to break, I seem to recall that at one time, the state of Texas provided, I don't know, but military help for folks that were medically trained in the military or something to that effect.
Yeah, we had the
When
Army
you
and
were
the
at-
Navy here. Yeah, we had the Army and the Navy, reserves, active duty down here serving as, medical strike teams, basically in the hospitals, taking over wards of the hospitals with military personnel. We're not at that level right now. We still have a lot of those agency nurses. It turned into a big a game of musical chairs. As every place started having problems in the summertime, everybody came here. So maybe other places were saying, "Well, our nurses are leaving to join these agencies, and they're going down to the valley." Well, now they're getting pulled everywhere, and everybody's got a problem at the same time. So it's like musical chairs. You take nurses from the valley, you put them in San Antonio. You take nurses from San Antonio, put them in the valley.
Mm-hmm.
It's Dr. James Castillo. Here's the Cameron County Health Authority, along with UT Health Science Center, Houston Brownsville Clinic, Professor Dr. Joseph McCormick, our guest this afternoon. We hope that Dr. Ivan Melendez can join in. He's from Hidalgo County. I'm Sergio Sanchez, along with Davis Rankin, Roxanne Fotis, Zach Cantu, and the KURV crew. And we welcome your comments and questions. The fastest way to get that to us is via the News Talk 710 KURV Facebook Live broadcast. Join us on your app at Facebook Live. Post your comment questions there. This is a COVID vaccine update for the Rio Grande Valley, presented by Burt Ogden and Fiesta Dealerships. The news is next.
The Hour News. This is News Talk 710 KURV.
4:33 on News Talk 710 KURV. Good afternoon. I'm Tim Sullivan. Donald Trump is the first president in history to be impeached twice. The U.S. House has voted to impeach the president for inciting violence against the nation for his role in last week's riot inside the Capitol building. This time, the House impeached the president with bipartisan support. 10 Republicans joined Democrats. Senate Majority Leader Mitch McConnell has said in a note to his fellow Republican senators that he is undecided whether President Trump should be convicted. McConnell wrote that he has not made a final decision. He will listen to the legal arguments when they are presented to the Senate. President Trump opposes violence, according to a statement read on the House floor as members debated whether to impeach him for his role in fomenting the violent insurrection at the Capitol last week. Trump's message was read by Republican Congressman Jim Jordan, in which the president urged no violence, no law-breaking, no vandalism in the run-up to the inauguration of President-elect Joe Biden. And President-elect Biden has selected Samantha Power, the U.S. ambassador to the United Nations under President Obama, to run the U.S. Agency for International Development. That's the agency that oversees U.S. foreign, humanitarian, and development aid. Coronavirus deaths in the U.S. have hit another one-day high, more than 4,300, as the country's attention is focused largely on the fallout from the deadly uprising at the Capitol. The nation's overall death toll from COVID-19 has now eclipsed 380,000. It is closing in fast on the number of Americans killed in World War II. More than 9 million Americans have received the first dose of the coronavirus vaccine as of Tuesday. But according to the CDC, More than 27 million doses have been delivered to the states. That means just 1/3 of the vaccines have gone into people's arms. Operation Warp Speed had said 20 million doses would be administered by the end of 2020. Consumer prices rose 0.4% in December, led by a sharp rise in gas prices. It was the largest advance in 4 months. And on Wall Street today, the Dow closed down 8 points, NASDAQ closed up 57, S&P 500 added 9. Your 710 KURV exclusive AccuWeather forecast, partly cloudy and cold again tonight, lows around 40. Mostly sunny, warmer tomorrow, highs from 75 to 79, and right now 66 at 710 KURV. News at the top and bottom of the hour, and when it breaks and on demand at KURV.com. I'm Tim Sullivan, 710 KURV.
Natasha Del Barrio, CEO, Bert Ogden Fiesta Dealerships.
We'd love for our customers to visit us online. We've got the largest selection of used cars in the Rio Grande Valley and new cars as well. It's one-stop shopping. So there's just a tremendous amount of variety to look through and make comparisons. You'll find online real-life photos, not just stock imagery of our vehicles, which I think is particularly helpful when customers are purchasing used cars. And then certainly nearly all of our vehicles come with a Bert Ogden certification, which is as strong and in some cases stronger than what one would see from a manufacturer. In 2021, we are committed to it being a great year for us. Your success is as tied to your mindset as anything else. And so we have committed 2021 is going to be a fantastic year for us. We saw the fruits of our labor and the adjustments that we had to make. You know, number one, many of the adjustments that we made in 2020 as it pertains to the digital retailing experience were in the works prior to COVID, just for the sake of convenience for customers and meeting customers in terms of being able to keep up with all of the traffic and activity that we've got coming into the stores. So we expect that to continue. Cadillac, we're incredibly excited about that. That's going to be the first line that we've got that really centers everything around the electrification of vehicles. We're really excited about this facility. That facility is going up. You probably see another facility in Harlingen going up as a brick and mortar facility. We're pretty excited about that one too. That'll be a used car facility. We've got another dealership, which I don't think we can yet announce which one it is, that's going to be going up in the city of FAR. I believe that one will be finished at the end of 2021 or the beginning of 2022. And we have two other lines that we're talking about bringing into the valley that we can't discuss yet. So there's a lot of focus on growth. There's a lot of job opportunities.
Thank you to the Bert Ogden family for today's special broadcast. Choose the brand and choose your vehicle at bertogden.com.
If you're looking for a local product or service, go to KURV.com and click on the Service Now tab. Supporting local business. News Talk 710 KURV and KURV.com.
Time is 4:38. Appreciate you tuning in to News Talk 710 KURV. We are simulcasting on our sister station, Classic 92.7 FM. It's a very strong signal for all of Cameron County, 710 KURV or AM signal valley-wide. Also live on Facebook, News Talk 710 KURV Facebook Live. I invite you there because that's the fastest way for you to interact. Post a question for this COVID vaccine update for the Rio Grande Valley. Cameron County Health Authority, Dr. James Castillo, and from the UT Health Science System, Dr. Joseph McCormick. Roxanne, back to you.
This one is to Dr. McCormick. Dr. McCormick, is the vaccine...
So I think one of the big unknowns here is how long does the immunity last? And there are two issues there. One is how long does the stimulation that our vaccines have given us, how long does that last, and how long does our body continue to make the antibodies to it? But it also has to do with these variants now. This is a virus that mutates far more even than influenza. On the other hand, and we know that's why we have to change vaccines for influenza each year. What we don't know is what does it take, how many mutations does it really take for the virus to be able to completely escape the vaccines that we're using right now. Thus far, the vaccines are working against these variants. So we're going to learn this as we go forward, whether this is going to now require new vaccines to be made over some period of time, maybe yearly, maybe others. And it also depends a little bit on how well we control the epidemic, because the better control we have, the lower the rate of virus replication. That is, fewer people are infected. So the virus has a lower chance of making all these mutations than it would if we continue to have this massive epidemic. And so, sorry, tell me the second question, Roxanne.
Well, it was if the vaccine will require, one shot or is this a yearly booster, and also if you can still infect others once you've been inoculated.
So I think the answer is right now, it would appear that the chances of you can certainly get infected after you've had the vaccine. The question is, and that infection might just simply boost your immunity. It might act as a live vaccine to boost your immunity. We don't know whether that you can actually be infectious once you get infected with the virus afterwards. I doubt that you will be, but we don't know that. The companies so far with the trials that are ongoing have not observed this. But I think time will tell us as we wait to see how well the vaccine does over time.
Did I hear you correctly, real quickly? I'm sorry, Serge, that you can still get infected even after getting the vaccine?
You can get infected with the virus. That doesn't mean you get sick with it. It just means that the virus can get inside of you and replicate to some level, nowhere near the level that you would if you didn't have immunity. And there are other vaccines. The Ebola vaccine does exactly the same thing. It doesn't prevent you from getting infected, but it does prevent you from getting sick.
Let me latch on this, since we're on this theme. Davey, I know you got a question. Let me ask this real quick.
Sure.
What do you say, Doc, either one of you, Dr. Mack or Dr. Castillo? Let's say somebody tells you, well, Doc, I already had it. I had COVID-19. I'm over it. So I'm not going to get it again, and I don't need the vaccine. What do you say to them, Dr. Mack?
So I've had this question now already many times because a number of people have obviously had this, and the question arises all the time. You should definitely get the vaccine. We don't know enough about the length of time that a natural infection is going to provide you immunity. And we know that there are people who are getting reinfected. Now, it's not highly common, but we know there are people who are getting second infections after, say, one last May or June or July. So the vaccine, you should definitely get the vaccine, even if you've had the infection. What it will do is boost up your immunity even more, because remember, getting the infection is like getting a vaccine. So your body's already made antibody. Now you can boost it up with the vaccine.
Any comments, Dr. James? Have we seen people reinfected? People had it and then get it again here in the Valley?
Reinfection's really rare so far. I mean, this is relatively new. And so we don't know, again, how long that natural immunity is going to last. People who have had mild disease, we don't know how much immunity that gives. It seems like the vaccine, after you got both doses, gives you the same level of antibodies as somebody who had severe disease, right? Not just the mild or the asymptomatic one. So we're not sure about how much natural protection you're going to get from a natural infection, especially if it was mild or asymptomatic. So definitely get the vaccine. And the other thing that the vaccine really does well is to prevent people from getting hospitalized with COVID or from dying from COVID. So that's huge. If this illness didn't put people in the hospital, I don't think it would be as terrible as it is. And if the vaccine can make it extremely rare to get hospitalized, even if you do get sick, if it can make it extremely rare to get hospitalized, that will be a huge turning point in the pandemic.
So one of the other issues about one dose. So one issue about the first dose is that not only is it about 50% or a little more effective, but it's particularly also effective at reducing the severity of disease if people do get infected.
And speaking of people who did get infected and are convalescing, how goes your supply, Dr. Castillo, when it comes to all that plasma you need as a therapy for folks who are infected?
Yeah, the plasma supply is down. Right now, the FDA, if you've had the vaccine, you're not allowed to be a plasma donor. Hopefully, they examine that a little bit more. But the number of hospitalizations is way up. The use of convalescent plasma is one of the few tools that they have in the hospital, and the number of donors is down. So if you've recovered from COVID-19 and you have not yet received the vaccine, to please donate. I believe you can donate every 3 weeks.
Yeah.
But there is a
15
note of
minutes to the hour.
caution
This is
here
the COVID
because
vaccine RTD update.
there is a note of
ahead,
caution
Dr. Mack.
about the plasma that I think we need to note, and that is that the proper clinical trials have not been done. And we're collecting plasma, and we don't know how much antibody is in the plasma. We don't know exactly who to give it to, and we already know that giving the monoclonal antibodies are just a highly concentrated antibody focused on the spike protein, and we know that works only early in disease. For the plasma, that's not been tested. In fact, the trials have been pretty much stopped with the plasma because it was totally unclear about how well it worked and in whom it should be given and when it should be given.
COVID vaccine update RGV, News Talk 710 KURV, Classic 92.7 FM, live on Facebook. Post your comments there. Davis, back to you.
This is a question for whomever. When will we be back to normal and not have to wear masks again and support the hand sanitizer industry? When do you think that's going to be?
So I think that's going to be well into this year at best. It will be facilitated when we get these other vaccines, I think. But it's not going to stop us right away from wearing masks. One of the side benefits, and the CDC just published this in the MMWR, has been a marked reduction in flu. And if you talk to the hospitals and the emergency rooms, they will tell you, gee whiz, we're not seeing the influenza-like illness that we used to see this time of year. And the CDC has now done a study to show that is because the sane people in the country are wearing masks. And that means that even flu is not being transmitted as it normally would this time of year.
Dr. Garcia, do you want to
If I
say
could branch
amen, or
off,
do you want to dissent?
Yeah.
Same.
No, it's about the same. We don't know the number for herd immunity. When everybody's had their vaccine, then you can imagine things getting more back to normal. But that's going to take a long time.
All right.
you talk about the opposite reaction from an action. Well, yes, wonderful, less flu and less kids touching each other with poopy hands, less strep infection. But all that, if you look at it on the family clinic side, less business for family clinics and overnight clinics. And I would imagine that on the front lines of medicine, Dr. Castillo, I suspect you might be hearing from a lot of medical providers that they're down in business, down in revenue, that they might be hurting. What can you share with me?
No, it's been terribly disruptive to the normal flow of things. When people were sheltering in place at home, that included, doctors' offices, and people are still worried about going to their doctor's offices. A lot of doctors have adapted. We're allowed, and where it makes sense for their business, to telemedicine. You've seen a huge surge forward in telemedicine, and thankfully our antiquated billing system on how we reimburse for healthcare, especially at the federal level, has been adapting to that, right? Rather than holding it down, they've been adapting to it. But yeah, it's had a major disruption in elective procedures, in think about things like orthopedic surgeries, elective orthopedic surgeries, colon cancer screenings, colonoscopies. All of that has been majorly disrupted.
Dr. Mack, I've got just a strategy question for you. Looking at the rollout of the vaccine, because relatively speaking, it seems that COVID-19 is mercifully quite survivable, Dr. Mack. 99 point whatever percent survive. And I know that leaves millions of others, folks that are vulnerable. Shouldn't we be focusing? Well, we are, I guess, on the medical side, you have doctors and nurses and first-line providers, frontline providers, great. But shouldn't this vaccine have gone to not only hospital people first, but then all nursing homes and everybody providing help at nursing homes. And then the care providers that go to the elderly in the community and the elderly in the community receiving private home care. And then, of course, all the folks who are immunocompromised from either liver or pancreas or heart conditions. Because if we take care of those folks first, or those folks deny, they don't want the vaccine, then that's it. We pretty much covered everybody who's most vulnerable, and we could open up society faster than before. What would you say, Dr. Mack?
Well, I think you're leaving out the people who are doing much of the transmission, and that is the younger people. They are ones who are doing a lot of the transmission, but there's no question that vaccinating the frontline people, the EMS folks, and certainly the nursing homes have been hit terribly all across the country. Now, many states have prioritized the nursing homes and the staff at the nursing homes. And that's been, again, and the CDC has made those a very high priority in terms of their recommendation for vaccination. So Dr. Castillo can comment about where we are with the nursing homes, probably at least in Cameron County. I know that there is an effort to do that. And certainly the 1A and 1B groups, the 1A groups, in fact, are all those nursing, the frontline people who are taking care of patients. They should be definitely the first, and they have been. The hospitals have really been doing very well at vaccinating their staff. The 1B people are all those at risk that you talked about, and that's where the effort is ongoing right now. The trouble is, if somebody's 35 years old and has underlying diabetes and obesity, how do you make sure that other than they're just telling you that, how do you verify that? How do you verify younger people who have underlying conditions, because they are also at risk? What now is happening is that generally, and again, I think Dr. Castillo will comment about this, but the aim is to get people over 65 who are the ones. If you live in the Rio Grande Valley and you are over 65, your chances of having diabetes, underlying diabetes, is nearly 50%. So that already tells you that this is a very high risk group.
Yeah, the entire population says. So what do you say, Dr. Castillo? How are we doing trying to inoculate at least nursing homes, the most vulnerable in the area?
So the nursing homes, for their staff, they were fortunate to be able to collaborate with the hospitals. HEB got a supply, and that healthcare workers were being able to schedule to go to those pharmacies. Pharmacies had supply. Some doctors' clinics got it. All of this was in the phase 1A. The hospitals got, at least locally, big supplies of the Pfizer vaccine. And there was even extra doses inside those vials. So they were reaching out to EMS to, you saw all that effort. And fortunately, a lot of the staff at the nursing homes who opted in to get the vaccine, because nobody was forced to do it, there was no mandate to do it, that people who opted in were able to get it. And then the hospital started reaching out more and more to other healthcare professionals who wanted the vaccine. And then a few people came around a little bit later, and they kept going deeper and deeper into that phase 1A. School nurses, I think us at the county, when we got a supply, we were able to work with school nurses, with people who are going to be vaccinators, those frontline healthcare personnel. But now that we're into the, trying to rapidly broaden it out to phase 1B, for people who reside in nursing homes, there's a separate federal distribution coming through the national chain pharmacies like CVS and Walgreens that's already earmarked for people who reside in nursing homes. So the staff have had access to the vaccine. The next is going to come the patients. And as you see big waves of vaccine get released into the community, through these big mass events and eventually through the pharmacies and doctors' offices, I think you'll see more of those people in the phase 1B category, 65 and over, people with risk factors, getting access to the vaccine.
Roxanne, back to you. You got a good question. I know the answer to that. I heard it in the news the other day, but we need to put it on this program. Go ahead, Roxanne.
Well, I just wanted to ask, because I fall under this category. I don't have any underlying health conditions, but I have a 4-month-old. So if a mom is pregnant or breastfeeding, can they also fall under that, phase where they can get a vaccine?
They don't fall into phase 1B because they're really not at excess risk for now. If you're a mom who gets gestational diabetes and you're obese, which you clearly are not, then they might fall into that. But right now, pregnancy is not in the 1B category.
Okay.
Dr. Mack and Dr. Castillo, maybe we can close on this subject. We've got about 2 minutes left in the broadcast. There was a report came out from an annual report from this communications firm Edelman that pointed to distrust among all populations, not only in the U.S., but worldwide, distrust of governments and distrust of all types of media. And that seems to be worming its way into the number necessary for inoculation and maybe even herd immunity. What do we do to push back? And what do you hear? First, Dr. Castillo, what do you hear in the community as far as any distrust when it comes to the vaccine, and how do we overcome that?
I think there's a lot of hesitancy. You know, some people have staked out their positions on one extreme or another, but there's a lot of people in the middle who are hesitant or confused, or they're hearing conflicting information. So I think it's really just about trying to, you know, keep presenting calmly, you know, the facts, and hopefully people can look to reliable sources to learn for themselves, or at least get that kind of information, rather than to, I guess, sources of information that are just maybe feeding into some fear or some sort of misinformation or amplifying misinformation. So again, that vaccine hesitancy, that group in the middle, or at least for any sort of healthcare decisions, but vaccine hesitancy, hopefully it's just about being as transparent as we can with the data, putting the real facts out there, but trying to just maintain our integrity and keep doing things the right way.
I think the
Dr.
other
Mack,
thing,
I need to give you 30 seconds. Go ahead.
yeah, I think the other thing is to continue the messages and show that people who are leaders in the health sector, in the political sector, in the business sector are all getting vaccine and recommending it. I think that the having models out there who are getting vaccinated is really a key way to do this. And one of the things we've seen is that the hospitals, so there were some staff members of hospitals who were reluctant, and that's now changing. And so more and more people are realizing that the vaccine is safe and that a lot of people are getting it, and therefore they're coming out to get it.
Good. Thank you.
Thank you, Dr. Mack, Dr. Joseph McCormick, UT Health Science Center, and Dr. James Castillo, Cameron County Health. A big thank you to Bird Ogden and Fiesta Dealerships for today's broadcast. We're speaking with Natasha Del Barrio, the CEO, Bird Ogden.
It's Miller
Fiesta
time.
Dealership. Ogden.
Thank you guys so
When
much.
you go online,
Bye.
just like you make a purchase on any retailing website,
Always good.
you can buy your car right online.
So we go back to our
You click the
regular
button
Zoom,
and
right?
Navigate through the number.